November 3rd, 2023. This is the HIC doctor, Dr. John Ellis from Oklahoma City, talking about stuff, especially federal workers' comp, VA, Social Security, legal medicine. Over 50% of litigation requires a doctor's white coat. The trouble is we have no training and we mess up the system. For instance, it's a state workers' comp, company driver, company truck, wreck, fused neck. The insurance company writes to the doctor, is this work related? Well, obviously it's work related, but the doctor said, I didn't see the truck roll. So that's the problem we have. Okay, now, federal workers' comp, VA disability law is ridiculously fair. If the employment factors contribute the slightest amount, it's 100% covered. If in service, if something happens to contribute the slightest amount, it's covered. If you're in the service 20 years, you get hypertension, it's covered because it happened in the service. Let's say you had rheumatic fever, you had a heart murmur. They didn't pick it up on the physical, they have to eat it. So that's the law. The trouble is, doctors don't know it, VA doesn't know it, many claims examiners don't know it, but once you get into the appeals process, they're good people. So that's the law. That's okay, this is life. Okay. Ask Doc Ellis. Larry from Texas, VA question, infantry, National Guard, has several conditions. If rating rules change before the adjudication decision, will I be subject to new rating rules or your grandfather, whatever it is? And speaking of that kind of stuff, let's say you file for rating years 10 years ago. And then a veteran service officer said it's easier to file a new claim. Don't do that. You want to get that claim approved and paid forward. Okay? It might be easier for the rating person, but no, that's called a Niemeyer. That was the veteran did that. Okay, here's Stephen, another VA question from Pennsylvania. Surgery prostate because of cancer. I wonder if the prostate cancer is service connected. Be interesting. There are certain things that certain places you've been can be service connected, or if you're around a lot of burn pits or chemicals, it can be service connected. Video conference instead of traveling to Oklahoma, sure. Then if they say no, then you can come. I'd always do that. Now, prior you said you were hitting a car, riding your bicycle. Your traumatic brain injury should be covered, and I'll tell you why it wasn't. Doctors, listen to me. When you say no loss of consciousness, that's a stupid statement. Everybody does it. It's no observed loss of consciousness, because if you have a concussion, that tape is not recorded. You can hypnotize that person and they can't go back and pull it out because it never got stuck in the brain. But they may be walking out and talking, like a football player, a prize fighter. But so loss of consciousness by a decision by an EMT, bullshit. You're not God. You can't say that. So, and there's no minor brain injury. You just rate it. Now, the way I rate brain injuries with the vet, y'all and I have the wife there. I can rate him 10, 30, 50, 70. And the other number she gives me is my scientific answer. Okay. So, yeah. So you can file for all that stuff and just go to Ellis Clinic, pull up the thing about VA, fill out stuff. $500 condition. Don't pay somebody $10,000 for a VA exam, and don't ever pay anybody that's going to get a piece of your reward. That's unethical. Okay, here's Stephen, another VA from Pennsylvania. Okay, that's that. Okay, got that. Okay, now Paige, I think you've got a question from Edna.
Yes, Edma says, can a claims examiner hold your submitted upgrades while you're waiting for a second opinion appointment that is over 30 days away? I've been told by 2 claims examiners that my upgrades will be determined by the second opinion doctor when I go for appointment. Thank you for all of your knowledge and assistance.
They do. Whether they should is another question, and they usually do that. They will use the second opinion doctor, but know this, the law is very clear in federal workers' comp that your doctor's medical opinion has more probative legal value. So that, so it's like we had a lady who has complex regional pain syndrome, something awful. We did a scheduled award, 90%. second opinion put 8%, which is just plain fraud. You son of a bitch. God, you have no clue how bad this. She's got all kinds of physical things you can see and photograph. And so it goes through stuff and denied. Then we did another schedule board. This time it was 86%. And then Paige, my claims person, calls her the other day. Well, they finally went back to the first one and gave you 90%, and she got a speeding ticket. Hearing that on the phone. It took 4 years, but you always win because the law set up in VA and federal to win. You just have to go through a lot of stupid stuff. Don't ever give up. Okay, Richard from Texas has a question.
How long does a person have to file an appeal on a denied case? Can you file another claim using updated medicals?
This is OWC. You always file updated medicals. You can always file. Now, there's sometimes you have 30 days. You need to have a doctor's report in 30 days or a letter saying, please give me an extension. You have a cumulative trauma injury, say carpal tunnel. You have 3 years from the last time you're employee to file. Okay. But you can always file a new claim. Now, and let's say you have a bad knee and it's work related in federal workers' comp, and it's been 10 years since you were an employee. But if that bad knee caused a limp and contributed to your back, you can have a consequential injury. And so there's no statute of limitations on that. Then there's things like firefighters and, cancers from that. It's when you make the diagnosis, you have 3 years to file. Okay, Paige, Richard from Texas.
We just did that one.
Oh, you just did that one. Okay. So, Sherry, you got one from Stephen.
I do. Dr. Ellis, I currently have a service-connected disability for tinnitus, Social Security disability, PTSD with depression. I believe that after my third CMP for OSA, I will finally be able to add this to the list. I am seeking a service connection of diabetes. My diabetes started after the service. I have a current DBQ from diabetes from Vanderbilt Hospital. What records do I need to submit to you? I was thinking my VA service-connected disability ratings and the DBQ from Vanderbilt, along with a Nexus letter from my doctor who has linked my OSA to my diabetes. I also want a service-connected heart condition, and the same exists started after the Army, and I have a DBQ with the same Nexus linking my heart disease to my OSA.
Oh, yeah, so that's more information than most people have. I might agree with those doctors. Okay. But let's say that you have thoracolumbar strain and you had weight gain. That's going to take care of your diabetes and all kinds of other stuff. And if the weight gain contributed to sleep apnea, that covers all kinds of stuff for your heart. Tinnitus contributes to hypertension, and that takes care of your heart. Tinnitus also contributes to sleep apnea. So there are a lot of things. So what would I recommend you do? You send it in, we look at it and see if it's worthwhile for you to spend money before you spend the money. It's $500 per condition, but you've got somebody from Vanderbilt. What you probably need are the magic words needed to make it medically legal acceptable for the VA. Okay? Because the doctors are not, like each state has its own magic words. VA has magic words, Social Security has magic words, Federal Workers' Comp has magic words. How to discuss all that. So send it to us, we'll take a look at it. Miles, question 6, would you read that one for me?
No problem. Doc Ellis, thank you for all the great information you share with us. My question is dealing with VA rating for sleep apnea. On my last sleep study, they recommended that I start using a BiPAP machine with oxygen supplement using an oxygen concentrator. I also have AFib. Would the use of the oxygen concentrator impact the rating for sleep apnea between the 150%? What would be the factors for the 100% rating?
How bad your sleep apnea is. You tell me how bad it is, and it's 50 or 100%. But having to have an oxygen, we may have a lung disease either due to your sleep apnea or some other service-connected condition, and then it can bounce up to the 100%. And is it aggravating your AFib, your sleep apnea? Sure it is. So your AFib should be a secondary service-connected. Here's Kat from South Carolina. federal workers' comp, 3 back surgeries, knee replacement, incisional hernia, a lot of stuff here. Let me just scan it. Have not seemed to find a doctor that's knowledgeable in the 6th edition AMA guides. Absolutely. Let me explain what that is. This is the 6th edition of the American Medical Association Guides Evaluation Experiment. Very complicated, very nerdy. But you need to find a doctor not only knows how to do that, but knows how to connect it to the federal workers' comp system, the FICA bulletins. For instance, you don't have to remember this. The book says, let's say you have shoulder. You look at a shoulder and range of motion is a percentage, a diagnosis is a percentage, whichever's the highest. If it's range of motion, that's you do range of motion by itself. If the diagnosis is that, and you can add any nerves to it. The FICA bulletin that Nicole, my person, knows better than I do, you can add the nerve to the shoulder. That's another ton of money. So you don't want somebody that does it for state workers' comp. You need somebody that knows how to do it and knows all the FICA bulletins and is a researcher like Nicole. You need Nicole do your schedule work, not me. And yeah, especially all the nerve impairments. You've got conduction studies. Yeah, that's on slam dunk. All right. And accepted conditions are knee, hernia, back put down. You need your back covered too. Now, in federal workers' comp, you don't get a schedule order or an impairment rating for hearts, brains, and spine because you don't need that to work for the government. No, actually, it's a 1916 law and a schedule award. What's that even mean? A cut off thumb and the hand had a schedule. So you could have a back with that you would rate under the AMA guides. You would rate them by the diagnosis, range of motion, all this put it together. But in federal, I could only rate the nerve down a leg. So you've got myopathy down in your leg. So your back could be rated, not the back, just the nerve down the leg. That's worth the trouble. And Miles, I think you've got number 8.
I do. This is from Jennifer. My dad, who's 85, supplemental claim for split patella torn cartilage left knee was denied after a CMP evaluator stated it was less likely than not, as his records were destroyed in the fire of 73. I know those are your favorite records, Doc. The VA could not provide any evidence to assess, but my father's long-term treating physician, or physical, it says, I think they meant physician, provided a letter stating it was more likely his knee pain was service-related. Any thoughts on appealing this unacceptable decision?
Sure. Now, it depends on what they see. You're from Massachusetts. I don't know how the raters are in Massachusetts. Some states are just crooks, right? But this is absurd. They've called your dad a liar. Now, the best records destroyed in the fire. So if you tell me that you hurt your knee and I believe it, that becomes a medical record, right? And so obviously that knee should be rated, and it should be rated, and make sure you go back to the date you first filed, and then you rate it what it should have been. I got 10% from knee. No, you got screwed out of 30. In other words, the kneecap by itself is 10%. If you have full range of motion, no grittiness, no weather change, ligaments are intact, you got 10%. But if you've got a strained ligament, it's loose. If it's mildly, slightly, it's 10%. If it's moderately, it's 20%. If it's severe or marked, it's 30%. So it's 10 plus probably 30. Plus you add the range of motion. And we want to go back to the time. Okay, so that's what we take care of our vets from Massachusetts. Okay, here's Julius from Ohio. Okay, this is email. Find out how to email, phone your office. It's real simple. Get online. If it's VA, pull this up, fill out the stuff, send this stuff. This is federal. Send it to us. We'll look at it, see if it's okay. Make your appointments. Not, we'll tell you what you need to do. We'll get it all taken care of. We'll walk you through the system. And we'll even help you fill out your e-comp and send it to the government. And don't worry, we'll do all that stuff. My staff is just phenomenal. I was applying for sleep apnea and migraines were denied. Surprise, surprise. PTSD. Okay, sure. We can do a Nexus letter for PTSD. Yeah. I had a senior federal employee out of Ohio who said he trains raiders, like in Muskogee, the raiding, Waco, depending on the state. The raiders are not well trained, and of course the doctors, nurse practitioners, and the PAs at the VA are not trained at all in how to do VA, and they don't understand it's supposed to be fair. Okay, and there's a bias against the injured litigant. Everybody has it, and you don't know it. Everybody's a racist against anybody files a claim. Let me prove it. Allstate ran an ad for extra months, prime time. We fight fake car correct claims to keep your car insurance premiums down by Allstate. Now, when you think about it, that says if you file against Allstate, they're going to fight you. And they're telling you that's the reason you ought to buy their insurance. That should have put them out of business. That's a Ron White 5-minute skit. But it worked because people really think that anybody files a claim is faking. In fact, I would have been VA exams for 3 years before I even looked at my last audiogram. Hell, I'm 20%. I'm going to file for that, give my wife that. She's the one that has to put up with this. But we now, of course, we all see the extreme cases where there's a bus wreck in Los Angeles and people jump on the bus. But that's rare, folks. And what happens is people are reluctant to file, or they get turned down. They get a 10 and they should have had a 30, and they quit. Don't quit. VA and federal, you win if you don't quit. And you find the doctor's got balls and will tell the truth. I get mad. I almost have a stroke when I see VA patients.
Doc, real quick, we got a question from YouTube here.
Good.
From underrated is the handle. Have a service connection for left ear perforation, which caused me to have severe tinnitus. The VA denies me for, in quotes, hearing, and not anything to do with my tinnitus, which gives me migraines. What do I do?
Okay. Your tinnitus or tinnitus is 10%. The way you diagnose it, you tell me you've got it, and I think you've had any exposure loud enough that you have to raise your voice. That can cause hearing loss. Okay. So all our teenagers going to the rock stars. Okay. So you've got the tinnitus. You should have 10%. Now, the hearing loss is based on your hearing test, your audiogram. Now, be careful. There are a lot of people in the VA that defraud veterans. I'll have people with hearing aids. You have to yell at them. You cover your mouth. They can't understand you. Bad hearing loss that under the AMA guides would be 30%. The VA would say 0, because what they do, they take the audiogram and then they have what's called speech discrimination. How well do you understand words? And so someone like this, that obviously can't understand stuff when I'm yelling right to his face, the audiologist will keep repeating the word until you say, I understand it. When you take that audiogram to VA, if they said, you understand it, if you didn't understand it, you say, I didn't understand it the first time. Aren't I supposed to, this is not an IQ test. I'm not supposed to try to put this together. I didn't understand it. Do I need to call the OIG and file criminal charges against you, bitch? That's just fraud. Okay. So, but now, some of you have hearing loss, and it's 20% or 18% in here, but it's still not met the criteria for the VA. But keep going back every year or two, because it's not going to get better, so it's going to get worse, and until you finally hit the threshold. Okay, but do it at the VA. Don't pay me money, and you can't go to Belton to get it done because they don't have what's called a Maryland CNC, little CD-ROM. That's supposed to say the words. So if you have someone speaking the words, especially as female, that's not off that CD-ROM. That's fraud. Okay. And that with fraud. And it's okay. So okay. Okay, here you also had a shoulder and back claim in 2003 denied for no medical records. Bullshit. That's just somebody who doesn't know what they're doing, no medical records. Okay, so there's a higher burden, but so if you've got a doctor who's giving you a Nexus report, by the way, the guy that I was telling you about said you should start with a Nexus report from a doctor that you pick. You don't ask the VA doctor to do that. They're afraid they're going to lose their job. They're probably not, but they're not getting any training, and they have that bias. Like Korean War veteran lost toes to frostbite, and the VA doctor wrote, I don't know if it's cold in Korea. Get an almanac. All right. DBQs. Okay. We'll do a DBQ if your veteran service officer really wants one, we'll do it, but they're not required. They're going to help, but they're not required. Okay. Secondary conditions, VAs, you do all that. You got a bad foot, then your knee, your hip, and back are covered in the future. Wouldn't be in state workers' comp, wouldn't be in criminal law, but it would be in VA and federal workers' comp. Here's Jules, non-combat PTSD. Absolutely. I had a Navy SEAL that, tough as nails. What gave him PTSD was he got the burial at sea duty. I had a Ranger, Vietnam, 2 tours, could handle that. What gave him PTSD, he got off the plane in Los Angeles, and a long-haired girl, long-haired hippie with her arms about around the baby, spit on him and called him a baby killer. That gave him PTSD. Now, let me explain PTSD, VA. It's not depression. It's not anxiety. And it's not whether your mommy loved you. If you come into the emergency room and I give you the wrong dose of IV adrenaline for asthma, you're going to remember that day the rest of your life. So if you have an event that causes a huge surging of cortisol and norepinephrine, you're going to remember it. And it's going to intrude on you. That's different than depression, different anxiety. Now, you treat it with the same medicine and psychotherapy, but that's what it is. So a lot of people get PTSD and they call it depression. No, there may be depression, but you should have 2 claims.
I was denied OSA 6 years ago. I would like to refile and make it secondary to my PTSD, in parentheses, anxiety. Do I need 2 Nexus reports, one for the OSA and one for secondary to the PTSD? Thank you.
Okay, don't refile. You want to open up, you want to appeal the last one. You want to go back to that first time you filed for sleep apnea. And we'll get that done. We'll get you a next letter for that. And the PTSD contributes to, because when you have PTSD, you don't have the rapid eye movement sleep, and it's just like you're in a prison camp, and every time you try to go to sleep, it wakes you up, and that's going to mess up with your thinking. If you have a ring in your ears, your sleep apnea is covered. If you've gained weight due to an injury to some muscular part of your body, like a foot or something, then that's going to make the sleep apnea covered. But you want them to go back to the day you filed and pay it forward. It's called a Niemeyer. Veteran named Niemeyer filed for that, and that's the case that holds precedence. You got number 12?
Yeah. So this is from Ant. I'm hearing Ellis Clinic is on the VA's unofficial blacklist of Nexus options.
Hey, let me read AI's. As of my last knowledge update in January 22, the U.S. Department of Veterans Affairs does not maintain unofficial blacklist of Nexus opinions. Okay, now, people that do legal medicine, the other side's always going to call you a whore. Now, I wouldn't mind if an insurance company called me a whore, okay? But I'm trying to help the vets out, and I'm sure there are some rating officers that think I'm terrible. But when they have an injury, guess where they come, okay? Just like in, this is federal, guys from South Carolina. You know what Claims Sanders said about you? I said, tell her keep it up, okay? Because he goes home, his mother says, you go see that doctor. So it's hard for me to get doctors to work here because the other side's going to call you a whore. When I started doing legal medicine 50 years ago, there were 2 whores in state workers' comp. 2 whores, okay? An orthopedic surgeon operated back with the rods would call it 0 impairment because the surgery made you well. That's a whore. Then the other whore, working for the ambulance chasing attorneys, would write 50% for a strained back or an operated back. Neither one of them touched the patient. Okay, so then when I started doing that, and I've seen whores all along. And a lot of times when I go to court, the judge will say, "What are you getting paid?" Which is a good question, right? But I've seen a lot of people who sold their soul. So just because I've got a white coat on, don't trust me. You wouldn't trust mechanics. Don't trust white coats. Okay, so there's not an official blacklist, but there may be a people that say, and so when they say don't see Doc Ellis, it just sends them in. Doesn't hurt my feelings. It's part of the deal. But I spell God G-O-D, not G-O-V for government, not T-H-E-Y for they. I don't care what you think. My wife thinks. Jesus reads my reports, and that's who I'm writing them to. Okay. You got another one there, 13?
I do. All right. So I'm not sure who this individual is. They just wrote KWRALLSB. Not sure how to pronounce that. So the question, first question is answered. Does Dr. Ellis do Nexus reports? If so, how can I purchase one for my back? I have a CMP exam November 8th, and just researched. I will probably get denied as I never went to a doctor while I was in.
No, of course, no one goes doctor in your service, especially during basic with a broken toe. You're gonna limp. You don't want to return basic. Also, back then you had more testosterone on brains, especially if you're a Marine or airborne. Okay. Like as a flight surgeon, I never saw a pilot except during the annual physical. The rest of it's done at the officers' club over a beer. And then a doc, I got this friend said, give your friend this prescription, take it to the clinic, or they'll get grounded. And so it takes a while for them to trust you. Okay. So you just go. You just go to Ellis Clinic, fill out the stuff for what you want, send it in. We'll give you a call, set it up, and we'll walk you through it. It's easy. Okay, this is it, Miles. When I entered the service, my exam noted mild scoliosis and sideways curvature. Back was denied. So you start off with curvature, and I'm certainly wearing all those backpacks and running up those mountains contributed to making your back worse. If it contributed that much, it's 100% covered. So that's an easy one. And you go to a chiropractor, so it's bothering you. Yeah, sure. Then you worked as a flight line police in the Air Force. You're carrying all that crap on you, carrying heavy weapons, and yeah, sure, your back's covered. And any nerves from your back down your legs. Yeah. Okay. The back was contributed to, aggravated in the service, and then whatever it is now, it is. And if it gets worse, you come back for another Nexus report and raise the rating.
All right, Doc, we got another question here from YouTube, and this is from Mr. B. I was denied seizures disorder 2002, but was diagnosed by VA for seizures in 2002 within 1 year of discharge, and was on medication for 10 years. Now the seizures are back. Lost teeth in my sleep. TBI.
Yeah. Okay. Oh, yeah. TBI.
It says TBI. The comment cuts off there.
Okay. Well, anyway, if you had a brain injury, your seizures are covered in the service. If you had a concussion, if you just got knocked out, if you just got dazed, I'm going to cover your seizures because it takes a while for the scar to start the seizures. But if so, in 1 year of service, the same as in the service. But if you had any intervening event in the service, like you're concussed and dizzy, that's going to make it any seizure disorder covered. Okay, I'm going to go back to this other guy after I didn't read this. Yeah, sleep apnea, I think at 50%. He was told to use an oxygen concentrator for a BiPAP machine. Could that raise the rating? Probably from 50 to higher. Plus, you also have atrial fibrillation. Having sleep apnea and requiring oxygen because you have your sleep apnea lowers your oxygen level, that's going to aggravate and contribute to atrial fibrillation. You should file for service connected for your AFib and your heart. Okay, here's hernia in the Army and nothing made file. Who cares? You tell me you had it in service, I believe you. The best records are the ones that burned up in St. Louis. You tell me, I believe you. And then I write it, and it becomes your medical record. Okay, so now here's from Pennsylvania. Currently rated 90%, tinnitus, insomnia, pain from abdominal surgery, orthos claims, neck, spine, knees. Also diagnosed depression, anxiety, sleep apnea. Never applied connection to those. Okay, because sleep apnea is 50%. Depression is going to be 10, 30, 50, 70, whatever your wife says, however bad it is. But you can add all that. Now, am I eligible for TDIU, inability to work? Yes. If you're not working and you have 40% impairment from whatever, you can be individually unemployable. Now, be careful. If you ever go back to work and get any money, you make sure you report it to the VA. Okay. Example, guy in basic training gets pneumonia, can't keep up. The drill sergeant wants him to quit, won't do him, takes him out in the woods, beats him up 5 times. Anyway, during the 1 year in the service, he breaks out psoriasis on his elbows, a rash. He gets 10%. And I see him many years later, and the psoriasis had turned to psoriatic arthritis. So I rated him 100% for psoriatic arthritis and individual unemployable do the psoriatic arthritis, also diagnosed brain damage, and also diagnosed PTSD from getting beat up. Okay. And so the VA doctors agreed, and that goes on. Then he gets a $12,000 check for work that he did before he was declared individually unemployable. And my federal government, Department of Justice, comes after him for 5 years in jail and $250,000 fine. They don't come after drug lords. They don't come after murderers, and they come after people that don't have a traffic fine left, okay? Because they're wimps. Okay. So anyway, so I write a 24-page letter to the judge saying basically, if that money was paid for after he was individual employee, he's committed a felony. If it's not, this is just a CPA and a calendar. And then I just lit into the Department of Justice, and they dropped those charges. He didn't even have to go to court. And he had an attorney spend all that money. What a waste of time. This is, yeah, so I'm your asshole. Let me take care of you. I love this.
Doc,
I got one more thing.
We got a question.
Hit me.
Okay. Mel B from YouTube says, I had a back injury on the job back in 2009. Got a medical retirement from VA. Am I still eligible for a one-time settlement even if I'm receiving first medical retirement?
You can have scheduled ward, yeah. That's called a scheduled ward, impairment rate. Yeah, that's different than retirement.
All right. Well, we have another question here from Mr. B. Again, is TBI and epilepsy rated together?
Mm-mm. Rate them separately. Do not let them combine them on you.
All right. Right now, unless we have other questions.
I got to show my little mug. This is not a patient. You don't have to send mugs to me, but I love this one. Inspired by Doc Ellis Q&A YouTube on June 21st. And of course, Doc Ellis, cartoon guy. That cartoon guy was done by Rick Rose, the vice president of IBM. Anyway, it says, number one asshole. That's who I am. That's we'll take care of you. We'll tell the truth. If you don't want truth, don't come. And bless you all. I thank you for being able to help you. This is the most fun medicine I've ever practiced, helping vets out and federal employees. God bless.
All right. Is that all?
Thank you, Miles. Thank you, everybody.